this is Dr. Green with Momenta Chiropractic, and today we're going to cover another exercise that we commonly use for tennis elbow or lateral epicondylitis, and that's an eccentric exercise for the wrist extensors. So eccentric means that we are shortening a muscle first, then loading that muscle, but we're slowly moving into the opposite direction, so we're lengthening that muscle, but we're doing it slower than gravity would allow if it were to just kind of fall, right? So it's all about slow, controlled lengthening under tension. So in order to do that, we typically use a band for that. You can use a dumbbell or a light kettlebell, but we like a band just because you're able to kind of modify the tension as needed. So what we're going to do is we're just going to step on the band to create our tension based on the length there. We're going to rest our forearm on the thigh. We're going to be bent at the elbow because, again, this position is a little bit more difficult when it's fully extended. So we're just going to focus on elbow down. When we start this exercise, we're going to start it in a position of a short muscle. So for the wrist, what we're going to do is we're going to take the tension out of that band using our other hand. We're going to go into wrist extension, and then we're going to load that muscle. As we allow it to flex, we're going to go slow and controlled, and that's the eccentric portion. And then allowing it to come all the way down, taking the tension out, resetting, placing the load back on, and slowly allowing the wrist to go into flexion. Okay, so the key with eccentric exercises is it's resisting the urge to just pull into that direction by slowly lengthening that muscle under tension. Concentric is pulling it the other way or shortening that muscle. Isometric is holding it in one position, while eccentric is lengthening under tension. The reason that we use eccentrics in this for this type of condition is typically to build strength, and it shouldn't be something that we feel a lot of pain with. If we start to feel pain in that area, we're usually not ready for eccentric exercises, so we want to take it back toward either concentric or preferably isometric exercises. So again, this is to help build strength in the muscle after we've already built some load tolerance within the tendon itself and the pain has gone down.